Here's where we start for you on all angles at 2 o'clock. Pretoria is considered the current epicentre of the cholera outbreak. That's according to Health Minister Dr. Joe Phaahla, who says the first cholera patient is a 56-year-old man from Musina who started complaining about abdominal pains 5 days after arriving in Hammanskraal.
Where we are now in Tshwane, the current epicentre of cholera in this metro, the first reported case is that of a 56-year-old male, originally from Limpopo, from Kiani in Limpopo, but who resided in Musina, in the town of Musina. I'm mentioning also this because as we trace the whole issue of where is the cause, where is the origin of the germ of cholera, some of these things then we have to reflect on. This patient is a police officer, and he had enrolled for a 3-week course at the SAPS College in Hammanskraal, for which he arrived on the 7th of May and started the course on the 8th of May. And on the 12th of May, a few days later, 5 days after arrival, complained of abdominal pain, diarrhea, vomiting, and was then taken by ambulance here into the city at the Mulmet Hospital on the 15th of May. The tests which were performed on the 15th of May confirmed cholera on the 15th of May, and then was also sent to the NICD for further confirmation, because it was done here in town with a private laboratory, and as required with a notifiable disease, they sent a specimen to the NICD, which also confirmed that indeed it was cholera. This patient is still in hospital, but we are told that he's in a stable condition, but is still being treated in hospital.
Staying with that story, tests on 4 water sources in the Free State were deemed non-compliant. Phaahla says this was due to the fact that the water contained too much chlorine.
According to reports from the Free State province, 4 water sources were tested, but the tests were deemed to be inconclusive because they said that the results showed that they were non-compliant, because there was a high level of a chemical called a high level of nitrates. And one of the colleagues who's here is one of our environmental health specialists, and they explained that that's because the water had been treated with too much of chlorine, because, you know, we put chlorine to disinfect the water. So by that time when it was tested, there was too much chlorine, so they were not able to, it was not possible to detect any organisms, any bacteria or any other organisms in that water.